And as Lucretia mentioned, a handful of athletes decided to skip the Olympic Games. The head of the World Health Organization, Dr. Margaret Chan, has been closely following developments in Brazil, and her organization has been helping authorities come up with an action plan. CCTV's James Chau had the chance to speak exclusively to her.
It's called the Summer Games, but luckily for Rio, in the Southern Hemisphere, it's now winter, when mosquito activity is typically lower. Still, some major athletes have chosen to stay away. I want to ask you, though, about the 10,500 men and women who will go to the Rio Olympics, but not only them, the people who live in Brazil each and every day. Are they safe?
Zika is a disease, a new disease full of uncertainty. Every day we are learning about Zika. Now, in the context of Brazil, yes, the people living in Brazil, we have provided the government with health advice how to minimize the risk of mosquito bite, because the disease is carried by Aedes aegypti. And now, of course, scientists are questioning whether or not other types of mosquito can convey the disease, can transmit the disease. There are means, there are ways that the government can do, and there are things that individuals can do to minimize mosquito bite. For example, on an individual basis, you can use mosquito repellent, you can wear protective clothing, light color clothes, long sleeve, pants, and that would reduce the risk of mosquito bite. Now, for the government, mosquito control, we call it vector control, is still the means now to reduce mosquito density and to reduce mosquito population and to reduce the risk. It is not zero risk, but the risk is low and it is manageable on an individual basis. So for visitors and athletes going to the Rio Olympic Games and the Rio Paralympic Games, the risk is low.
It's sad, but we as a world, including the media, seem only to be concerned about a disease once it becomes an emergency. Far too late, of course. What has Zika taught us, and what does it continue to teach us about proper planning, but also strong policies?
Zika is a very important disease that teaches all of us lessons on a daily basis. Number one, Zika is a new disease. It is full of uncertainty. In early February, when we came out to advise the global community through their ministries of health, we talk about the importance of preparedness, being able to detect the disease, we call it surveillance, and do the laboratory diagnosis and share information. But as we learn more about the relationship between Zika infection during early pregnancy in women, we came out with recommendation. WHO and other government officials recommended that pregnant women or women who plan to have a family should not travel to areas with local Zika transmission. And of course, as I said, we do not advise pregnant women or women who plan to have a family soon to go to the Rio Olympics. But all other visitors and athletes, the risk is very low and the risk is manageable.